dear participants of the conference, ladies and gentlemen, distinguished guests. It's an honor and privilege for me to greet you today on behalf of the Minister of Health of Azerbaijan. I would like to say special warm welcome to our international guests. In the coming 20-25 minutes, I'm going to deliver you a presentation about my country's perspective on health and climate. But this presentation will encompass a little bit more than only health and climate issues in Azerbaijan, because it's kind of difficult to understand the challenges without knowing the background. So I will start with the system of healthcare in Azerbaijan, including historical aspect, and then I will move to some brief information about the country itself, about its demography and climate, and then we'll move to climate change and health-related issues. If I may ask for assistance with, okay, good. So history of healthcare system in Azerbaijan is strongly linked to the history of Azerbaijan itself. Azerbaijan was a part of Russian Empire since the end of 18th century to 1917, when Russian Empire collapsed because of socialistic revolution. After the collapse of Russian Empire, Azerbaijan declared independence, and independent Azerbaijan Democratic Republic, it was declared on May 28, 1918. It was the first democratic republic in the Orient, both in geographic Orient and among Muslim countries, Orient. Here at the pictures we can see the first sessions, first meetings of the parliament and of the cabinet of ministers of Azerbaijan, dated back to 1918. Next slide, please. Okay. Azerbaijan Democratic Republic existed for only 2 years, about 2 years, from 1918 to 1920. Then it was, occupied, the territory, the country was occupied by Red Army, Bolshevik Soviet Army. But during these about 2 years, a lot of things have been done for the sake of people of Azerbaijan. Healthcare that time was in very difficult, troubled condition. There was really no medical infrastructure in the country, no healthcare system for general public. There were only few hospitals, a couple of hospitals in the capital, Baku, and one hospital in Ganja, the second largest city of the country. There was a difficulty with war, with Armenia and Russian Bolsheviks. Number of doctors, especially those who could speak native language, was very low. So general population had nobody to apply to. There were too many untreated patients. There was really no epidemic control, so epidemics of infectious diseases was spread all over the country. And there was no medical education, so no system for preparation of healthcare workforce. Next slide, please. Azerbaijan Democratic Republic, for a short time, did a lot of things to address this situation. And the first step was the establishment of the Ministry of Health, which was established on June 17, shortly, in just 1 month after declaration of establishment of the ADR. And one of the first decrees of the Ministry of Health was the establishment of emergency medical service. There was no emergency medical service in Azerbaijan that time, and here at the picture we can see the ambulance, horse-driven ambulance car of that time, and it was again a big step forward. Another big step forward was the establishment of the Faculty of Medicine in 1919. There was no higher education and higher education institutions in Azerbaijan that time. In 1919, the first university, Baku State University, was established, and one of its faculties was the Faculty of Medicine. So thanks to this Faculty of Medicine, for a short time, just in 5 years, national local healthcare workforce, doctors, have been producing to provide the medical services to local population. Next slide, please. The Soviet period lasted from 1920 to 1991 for quite a long time. And during Soviet time, Azerbaijan was one of 15 Soviet socialistic republics. Healthcare in Azerbaijan that time was in the same design with other Soviet countries, Soviet republics, and it was called Simashko system. Simashko is a name, actually surname, of the first Minister of Health of the Soviet Union, and the system of healthcare he founded that time was later named after him. And Soviet Simashko model of healthcare was based on two main pillars. The first pillar was free of charge medical services. So medical services for all population independently of their job, independently of their social status, and etc. It was absolutely free. There was no paid medical services in the Soviet time. The second pillar was the preventive medicine, the stress to preventive medicine. And it was said that time that it's easier to prevent a disease than treat a disease. So preventive medicine was very strong in the Soviet time in Simashko model with a network of outpatient clinics, including outpatient clinics in factories and manufacturing fields and all other places with regular checkups of population. Another peculiarity of healthcare in Soviet time was the central regulation from Moscow. All healthcare systems in all 15 socialistic countries worked at the same scenario, which was given from the center, from the Moscow. Healthcare in Azerbaijan during Soviet time had also had challenges, and a lot of challenges, but I would like to highlight some of them. One of them important challenge was a lot of epidemics of infectious diseases like malaria, cholera, typhoid fever, and others. And it was a real challenge, it was a real difficulty, and it was actually addressed by some years and decades of intensive work. Another challenge was the World War II. During World War II, Baku became a real hospital base for Soviet army with a lot of injured soldiers, officers, civilians getting treatment here. About all public buildings were changed to hospitals, like schools, museums, theaters, etc. And it was, of course, a very big load to healthcare of Azerbaijan that time. And last but not the least, in the Soviet time, there was real lack of scientifically proved approaches. So many things during Soviet time in medical science, in practical medicine, was not evidence-based, which is now a regular standard. And all this resulted in deviation from the way the medical science, medical education, general healthcare system developed in other countries, especially in Western countries. We can still see it when we go to the post-Soviet countries. We have about the same system of healthcare and very alike system of medical education. The only exclusion could be Baltic countries, which are different just because now they are the members of the European Union and they build their work according to EU directives. May I ask the next slide, please? Azerbaijan got its second independence after the collapse of Soviet Union. It was in 1991. And that time was a very tough, difficult time in the history of Azerbaijan. We had serious political crisis here in my country. We had again war with Armenia, and our neighbor occupied 20% of the territory of Azerbaijan. You can see it in the map. We had thousands killed and injured civilians, mostly civilians. And a very big load to healthcare was 1 million refugees and internally displaced persons. about 300,000 from Armenia and about 700,000 from Karabakh region. And we had to deal with all this flood of refugees. Moreover, we had deep economic crisis that time, just like all other post-Soviet countries. And all this resulted in insufficient government funds for healthcare, and insufficient government funds resulted in development of private sector in medicine. And development of private sector in medicine resulted in high out-of-pocket payments. So population, general population, got relatively medium or high quality medical services, mostly in private medical institutions, and they had to pay for that. It's worth to mention that nowadays, when we have recovered our healthcare system and the state-owned medical system is very strong, we still have very strong private system of medical services as well. Next slide, please. May I ask? Okay, good. So this troubled time ended about 1993 when our national leader, Heydar Aliyev, came to power. Due to his efforts, he achieved ceasefire with Armenia. He opened an open dialogue with all political parties and stakeholders, thus stabilized situation in the country and prevented a kind of civil war. Very important thing was the signing of the oil contract and start of exploitation of oil and then gas of Azerbaijan that found the base for recovery and steady growth of the national economy. Growth of economy resulted in increase of investments in healthcare. And next slide, please. Increase of funds allocated for healthcare brought to the condition that we more or less have now in our healthcare system. For the past 15 years, the main achievement of our healthcare system are the capital investments that were done to healthcare infrastructure. About 750 medical facilities, hospitals, outpatient clinics were built from zero or capitally reconstructed. It's a very big number for a country with 10 million population. We started and we continue reforms in medical education. We joined the Bologna process since 2009. We started the residency program for specialization from 2011. Before it was 1 year internship, just like it was in the Soviet time. We started the objective structured clinical examination from 2014. And recently in 2022, Azerbaijan Medical University, which is the leading medical higher education institution in Azerbaijan, passed the international accreditation of its programs. All this would not be possible without strong support from the leadership of our country. Here at the picture, we see the president of our country, Mr. Ilham Aliyev, and our First Lady at the opening of new hospital in Sumgait, the third largest city in Azerbaijan. Next slide, please. If we speak about challenges that we have due to climate change, we cannot skip the challenges that we have during COVID time. So COVID-19 pandemic in Azerbaijan was a big challenge for our healthcare system, just like it was in other countries. Shortly after the announcement of the pandemic by the WHO, the task force was established at the Cabinet of Ministers to coordinate all work and all efforts that was done during that time. Healthcare workforce was mobilized. Doctors and nurses were mobilized to serve the patients. Laboratory capacity increased from just one laboratory that could do COVID-19 test to 42. It was done just in a few months. Many hospitals were shifted to COVID hospitals, and apart from it, we had 11 modular hospitals which were built just for COVID patients, to treat COVID patients. Azerbaijan was one of the countries who started vaccination against COVID-19 early. We started in January 2021 with 4 vaccines available, and it was free of charge. Azerbaijan demonstrated international solidarity in fighting COVID-19. We donated 10 million United States dollars to the World Health Organization. Apart from it, we donated 270,000 doses of vaccines for countries in need. So this is very important. This was a challenge that helped us to learn lessons from difficulties and problems of healthcare. Next slide, please. Now, our vision forward is building resilient healthcare system. And we consider that to build a resilient healthcare system, it must be based on 3 main pillars. First of them is development of human capital, which is very important. No human capital, no medical system. Healthcare workforce and continued professional development are the core of the human capital in healthcare. Another important for us pillar is digitalization of healthcare. We are working on creation of unified digital platform for all healthcare providers. We work on digitalization of all medical services and accordingly on data collection and analysis. You can see in the picture on the right side, we have already implemented some electronic solutions like e-prescription, e-sick leave, e-epicrizis, and for pharmaceutical products, track and trace system. Very important pillar is the financing. Financing of healthcare in Azerbaijan significantly changed from 2021 when state mandatory health insurance system was rolled out. Mandatory health insurance started with the benefit package for population with about 2,000 services. Now, just in 2-3 years, this number reached more than 3,300 services for population. This is a big step forward to universal health coverage in Azerbaijan. Next slide, please. Now let's move to effects on climate change, on health and healthcare. If we look at effects of climate change generally in many countries in the world, we can divide them to 2 main groups. One are direct effects. Another group is indirect effects. Direct effects of climate change are mostly related to global warming and are mostly related to heat waves and heat strokes that suffer the population. Also, let's not forget about injuries related to extreme weather conditions like floods, storms, wildfires. The increase of number of these calamities, extreme conditions, results in increase of number of damaged people who are injured by the aftermath of these conditions. Another direct effect is increase of complications and increase of deaths of patients who suffer non-communicable diseases like patients with cardiovascular, respiratory, renal, endocrine, and other diseases. Let's not forget about impact to mental health, which is also very important, especially impact to patients, to sick people, impact to mental health of child and adolescent. Something that what is many times neglected, it is occupational safety. Impact of climate change to those who work outdoors is also very important because those who work outdoors many times are unprotected from temperature, from sunstroke, heat stroke. And this is actually an issue which is related to occupational health and at the same time climate change and health. And all these effects are multiplied when we speak about vulnerable groups. Those citizens who are of vulnerable groups, like pregnant women, children, elderly people, people with disabilities, people with chronic diseases, homeless, refugees, marginalized groups, etc., they are all the most suffered part of population who get this direct effect of climate change, and who suffer worst this direct effect of the climate change. Next slide, please. Indirect effects. Indirect effects of climate change to health and generally healthcare system are related to mostly communicable diseases. Here we can speak about change of distribution, abundance, seasonality of pathogens and their associated infections. We can speak about spread of infections because of problems with clean water and sanitation. And let's not forget about floods. Floods, they also worsen the sanitary condition, and they may result in spread of infectious diseases. Here we should mention the change of geography of vector-borne diseases, diseases which are transmitted by insects like malaria. So global warming, change of temperature, rise of temperature results in change of geography of insects, and they can migrate to the countries they have never been, or at least for the last centuries, never been met before. Very important and maybe even crucial for future problem is antimicrobial resistance. Antimicrobial resistance is a problem that modern health science, medical science, tries to cope. And I would like to mention that this problem is especially significant in Azerbaijan and is in many post-Soviet countries as well. So change of profile of infection, change of profile of pathogen, exchange of their genomes result in increase of antibacterial resistance, antibacterial resistance, and it's a problem because typical drugs, typical medicines used for treatment of infectious diseases may not work with some patients. Something futuristic but possible, new infection agents. We have glaciers, we have polar ice that is thawing, permafrost, which may unfold infections hidden there for thousands, maybe millions of years. And those new infections would be new for our population that may result in new diseases. We should not forget about effect of climate change to food security. Food and nutrition shortages of population results in starving, results in malnutrition, and results in many other health conditions, health problems in general population. And last but not the least is the impact of climate change to One Health. One Health means health not only of humans, but health of all alive beings in the world, like animals and plants. And effects of climate change is not only to health of humans, it's also effect to animals and plants. So One Health, One World is changing because of climate change. Next slide, please. Brief information about my country, just to understand the climate change issues. The area of Azerbaijan is 86.6 thousand square kilometers. The population is slightly over 10 million. We have about equal proportion of females and males. Life expectancy at birth now is 76 years. It dropped down during COVID time, but then came back to the figure of 2019. And median age is 33.8 years. Our population is an aging population. We are going towards aging of our people, and let's not forget that impact of climate change is more dangerous for aging population. Landscape of my country consists about 50-50. Half of the territory of country is with mountains, mountain ridges, crests, highlands, plateaus, and about half of the territory are plains and lowlands. The landscape is very different, and what you see here in Baku is very different from what you can see if you go to west, if you go to the provinces of Azerbaijan. Climate of Azerbaijan is very diverse. We really have 9 of 11 existing climate zones in Azerbaijan, so very different climates in different provinces in our small country. And let me point your attention to annual mean temperature. Annual mean temperature in Azerbaijan now is 13.84 degrees Celsius. And in the bottom of the picture, we can see the graph of changing the average temperature during since 1901, for more than 100 years. And in 1901, the mean temperature was 12.67. So rise of temperature is more than 1 degree for slightly more than 1 century. Next slide, please. Now let me point that development of Azerbaijan, of my country, is based on some decrees and some state programs. One of them is Azerbaijan 2030, which points the national priorities for socio-economic development. An important thing is that there are 5 priorities in that program. One priority, number 3, is areas of modern innovations and competitive human capital. And one of the goals, goal 3.3, is healthy lifestyle of citizens. It's actually everything about the health and well-being of the citizens. Also, we have priority 5 of the program, which is a clean environment and country of green growth. One of the goals, like 5.1, is high-quality ecological environment. So approach to climate change through environment and through health-related aspects are based on our state programs. Next slide, please. Important things happened in the end of 2023. One of them was at COP28, when Azerbaijan joined COP28 UAE Declaration on Climate and Health. Another one, again, it was December of 2023, when 2024 in Azerbaijan was officially declared a year of solidarity for a green world. So this year, 2024, goes directly through all aspects related to environment and climate change. Next slide, please. Another important thing was the fact that Azerbaijan was selected as host country for COP29. So all these drivers, declaration, year of solidarity, and COP29, they are all drivers for change in my country towards more green, more resilient, and more citizen-oriented, healthy future of the citizens' actions. Now, what we can do and what we are doing to mitigate impacts of climate change to health of our population. In my point of view, the first and very important thing is the raising of awareness. Awareness of healthcare workers and awareness of general population. Climate change is something that many people do not think about. Many healthcare workers do not think about. And many times when we speak with our doctors and nurses about climate change and its impact to health, we see questions in their eyes. They do not understand what's the link. So very important thing is to raise awareness of them, as well as of general population. Otherwise, we may not have a surge of efforts to cope with this climate change issue. Another thing is coordination in healthcare emergencies. The healthcare emergencies like floods, storms, wildfires, climate change related, maybe climate change not related like earthquakes, it's very important to provide quality healthcare service for injured persons in time. So this coordination of different stakeholders in case of emergencies is very important. What is important, I'm alarmed that time is up, and I will borrow just 2-3 minutes of your time to finish my presentation. So what we are doing is a proactive epidemiological surveillance to monitor the infectious diseases in Azerbaijan. And let me inform you that Azerbaijan was recognized by the World Health Organization as a malaria-free country, and we got certificate in 2023. And let me mention that this certificate is not one-off document. We may lose it if climate change results in relapse of malaria in Azerbaijan. So what is important? It's important to work on prevention of malaria and other diseases in my country. Another important thing is sharing information and monitoring epidemiological situation in neighboring countries, because infection agents many times come transboundary from the neighboring countries. So cross-border exchange of information exists between Azerbaijan and Russia, Azerbaijan and Georgia. We closely monitor the epidemiological situation from open sources in Armenia and Iran to be aware about the change of profile of infection like dengue fever in Russian Federation. Very important thing is screening of population for non-communicable diseases. First of all, cardiovascular diseases. Patients with cardiovascular diseases are especially vulnerable for heat stroke. And it's important, and we work on it, the action plan for antimicrobial resistance. As I already mentioned, it was a real challenge and big problem in Azerbaijan. Also, I would like to not forget vulnerable groups. We have to pay special attention to vulnerable groups in all steps, in all actions that we take related to climate change and health. And again, last but not least, healthcare financing. Financing is the cornerstone of efficiency of healthcare system. So if there is no enough finances, enough budgeting for healthcare, it's very difficult to struggle with diseases, and it's more difficult to prevent diseases. So healthcare financing inside the general financing of climate change related issues is also very important for Azerbaijan and for other countries as well. Next slide, please. Beautiful picture. We all hear and sometimes speak about future travels to other planets. We plan to colonize Mars, I don't know, to build a special colony in the moon and to move to other galactics sometime in future. This is our dream, but what is the reality is the next slide. The reality is this. The reality is that there is no planet B. And if there is planet B, it will be too late for us to do anything. So that's why what we are doing with the climate change should be done now. What we are doing with healthcare and health impact, impact to health of the climate change should be done now, should be addressed now. The sooner we start, the better result we achieve. This is all. Thank you very much. Could you please move to the next slide, the last slide? Yes. Thank you for your attention. Again, warm greetings from the Ministry of Health of Azerbaijan. This is the building of our ministry, and I will be happy to hear your questions, if any. Thank you very much.
Thank you so much, Deputy Minister Zeynalov. We had prepared a couple questions for you and received some from our online. However, you very much addressed our questions in your talk, so maybe we can just reflect on that for a moment. we were going to ask you about we were going to ask you about the climate effects on health that you're already experiencing in Azerbaijan. Hearing your remarks there was a really helpful reminder for us. This group of health and development professionals are more used to thinking about lower and middle income countries where the infectious disease burdens are higher. So it's helpful to remember that non-communicable diseases are impacted in big ways. You mentioned specifically heat, mental health. You ticked through a number of things that are important, including the threat that we all face of the greater likelihood of emerging pathogens. And I really appreciated your COVID-19 response. It sounds like Azerbaijan was really on top of that. Maybe for starters, could you comment on, as part of the resilience, you already cited a lot of investments in infrastructure, in health workforce, and the curriculum redesign that you're doing, plus training, and surveillance and epidemiological surveillance more assertively as a form of resilience for early detection and preparedness. Do you feel like Azerbaijan is ready for the next COVID-19, which we certainly know is a more likely scenario in the context of climate change than otherwise would be?
Thank you for your question. Let me start with information about the challenges we face about the climate change here in Azerbaijan. The vast majority of challenges we face about the climate change is increase of the temperature and increase of heat strokes in my country. Just before coming here, I took the statistics on heat strokes for the last 10 years, and it's increasing. The only year when the heat strokes were below the level, it was 2020, the COVID time when everybody was at home, no outside activity. So heat strokes are on rise. Another thing that we face here in Azerbaijan are issues related to floods. We have a lot of floods for the last years, and sometimes even in Baku, which is generally dry area. And what we are doing to cope with it, we have built a healthcare emergency group, including epidemiologists and doctors on infectious diseases, to be ready to work on the sites, on places, to cope with these problems. About the next COVID-19 pandemic, if you ask me about our preparedness to COVID-19 pandemic, yes, we are ready for COVID-19 pandemic, but I'm not sure if we are ready for any other pandemic. So I don't think any healthcare system is ready for next pandemic. We can only declare it, but when it happens, we sometimes see that everything is quite different. So what we have to do, I mentioned it in my presentation, we have to build a resilient healthcare system. Resilient healthcare system needs financing. If there is no financing, you just try to do your daily work and you cannot prepare for future challenges. So it is very important, the preparedness, and preparedness to very various and different conditions, because they are not the same. Very different, but the result is the same. The result is that population is suffering, dying and getting ill.
No, excellent. And it's true that the components of a resilient healthcare system prepare us for the impacts of climate change. And that's what we spend a lot of time thinking about, how to build resilient healthcare systems in less wealthy countries too. But those are also the same strengths that prepare us for a pandemic as much as can be, to have those early detection, preparedness, emergency plans. So you've touched on all of that. Wonderful. And on the financing front, I think it's important, and this concept has come up a lot over the last couple of days, to remember that that investment is probably less than the cost of not making the investment in the end. And so we've talked a lot about, as a community, getting better about quantifying the costs of inaction as well, so that we can make informed finance and policy decisions, but that's great. So our other question was going to refer to Azerbaijan being one of the signatories to the COP28 Declaration on Climate and Health, and you mentioned that. And then you've already touched on some of the systems investments and reform that are resulting from that resolve. So you anticipated our questions and answered them very well, but we're thrilled. I really enjoyed hearing about the history and evolution of Azerbaijan, learning more about the geography and demographics and ecology of Azerbaijan. With COP29 coming in November, there will be a lot of focus on the healthcare system here, and it's great that you'll be able to lead by example and point to those preparations and investments you're making. Anything else, reflection on COP29 in November and the role that the Ministry of Health will play in preparing for it and during COP?
Thank you for asking. COP29 is a very important conference for Azerbaijan. Azerbaijan has never accepted such a big conference before, and such an important conference. That's why this is something that we all feel ourselves obliged to do our best to hold this conference as better as we can. As a Minister of Health, we work in two directions. First direction is the applicable direction. We work on medical services provision. During COP29, we will have thousands of guests arriving here with their health problems, with their diseases, with their infections, and so on, and we have to be prepared for that. And this is an important task of the Minister of Health. Another part of our work related to COP29 is the work on content of COP29, which will be dedicated, part of it will be dedicated to health impact, climate change and health. And here, the Minister of Health, together with the WHO, will develop a program and will develop a content. And I hope that if you have a chance to participate at COP29, you will see it.
We will certainly be here for COP29, very much looking forward to it. We're watching your progress and preparing for it with great interest, and we heard from Yelchin Rafiev on Tuesday about the progress, and that's encouraging. I hadn't actually thought about the healthcare service provision to that quantity of guests. That's a very important operational aspect of COP. So thank you so much for being here. It was really a pleasure. Yeah, and see you soon.
Thank you for your attention.